Bismillahirrahmanirrahim. Physiologic anatomy of the male sexual organs is discussed in this video. So testes that lie in the scrotum, they are composed of about 900 coiled seminiferous tubules, and these are about each of this is about 0.5 meter long, and they are responsible for formation of sperm. After that, the epididymis is there, and this is formed by another coiled tube about 6 meter long, and the epididymis receives sperm from the seminiferous tubule. The next is vas deferens, and this epididymis leads into the vas deferens, which enlarges into the ampulla just before entering the prostate gland. Two seminal vesicles on each side of the prostate empty into the prostatic end of the ampulla. Their secretion, along with those from the ampulla, pass into the ejaculatory duct. Then these ejaculatory ducts pass through the prostate and empty into the internal urethra. Then there are prostatic ducts. They also empty into ejaculatory duct and contribute additional secretion. Urethra is the final conduit from testes to exterior. It is lubricated by minute urethral glands and the bulbourethral glands, that is termed as Cowper gland, near its origin. This image is showing the anatomical diagram of the male reproductive system, showing both the internal and external structure. The urinary bladder, it is the hollow organ that stores urine. Then there is prostate gland that surrounds the urethra and it contributes to seminal fluid. Then ampulla is the enlarged part of the vas deferens that stores sperm. Seminal vesicles produce seminal fluid that mixes with the sperm, and then there are ejaculatory ducts, and this ejaculatory duct is formed by the fusion of the vas deferens and seminal vesicle duct that carries semen into the urethra. Then there are bulbourethral glands or Cowper's gland. They produce mucus that lubricate the urethra, and vas deferens transport sperm from the epididymis to the ejaculatory duct. The external structures are urethra, a shared passage for urine and semen running through the penis, and the erectile tissue of the penis that facilitate the erection during arousal. The glans penis is the tip of the penis, and prepuce is the foreskin, the fold of the skin that covers the glans in uncircumcised male. Then scrotum is the pouch that holds the testes outside the body, and testes are the organ that produce the sperm and testosterone. Epididymis stores and mature the sperms. This illustration is showing the internal structure of the testes and the pathway of the sperm from the formation of to the vas deferens. So the seminiferous tubules are highly coiled tubules where spermatogenesis or sperm formation take place. They occupy the majority of the testes. Then there is a rete testes, a network of tubules that collect sperm from the seminiferous tubule and channels it into efferent ductules. The efferent ductules are the small ducts that carry sperm from the rete testes to the epididymis. Then there is head of the epididymis, the top portion of the epididymis where the sperm first arrive and begin maturing. Then there is body of the epididymis, the central region where sperm continue to mature, and then finally the tail of the epididymis, the final section that stores mature sperm until ejaculation. The vas deferens is the muscular tube that transports sperm from the tail of the epididymis toward the ejaculatory duct, and there is the testicular artery that supplies oxygenated blood to the testes. So the sperms are formed in the seminiferous tubules, and from these seminiferous tubules move into the rete testes and pass through the efferent ductules first and enters the epididymis, first head, then body, and then tail, and then travel toward through the vas deferens for ejaculation.